Diabetes is a metabolic disorder in the blood sugar. This is a chronic disease in the inability of the body to metabolize sugar, stemming from two main causes. The pancreas does not produce insulin, and the cells in the body are resistant to insulin. From there are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is a condition in which the pancreas does not produce insulin, leading to a lack of insulin in the body. It makes sugar from food being loaded into the body that cannot be metabolized, leading to stagnation in the blood. People with type 1 diabetes are usually children and are often quite rare. The main cause of type 1 diabetes is genetic and genetic factors. Type 2 diabetes is a condition in which the body can still produce insulin, but the cells are resistant to insulin. So instead of transporting sugar to the cells for energy, the sugar builds up the blood. Currently, with about 90 to 95% of people with diabetes in the world are type 2 diabetes. The main cause of type 2 diabetes is often due to improper nutrition, being overweight and obese. Gestational diabetes is blood sugar disorder in women during pregnancy. Women who have had gestational diabetes during pregnancy have an increased risk of developing type 2 diabetes after the pregnancy ends. For diabetes, if the patient is not treated promptly or is treated incorrectly, it will lead to dangerous complications such as kidney failure, stroke, cerebral infarction, myocardial infarction, and even death. According to global statistics, diabetes is one of the three leading causes of death in the world after cardiovascular disease and cancer. As for diabetes, we must understand that this is a chronic disease, and it is not correct to say that it is a disease to be cured. Therefore, it is impossible for a patient to wish to use only drugs to cure diabetes. The most important thing for diabetes is to control, find ways to solve the disease from the root cause. The patient needs to solve the problem if insulin-resistant cells and restore pancreatic function to produce enough insulin needed. Currently, to control diabetes, the main methods are as follows. The first is that acute control with use of Western drugs to lower blood sugar quickly. This is direct insulin injection, which only solves the immediate problem, slows down the duration of complications, and does not solve the root cause of the disease. It especially cannot be used for a long time because many side effects of risk of complications that are extremely dangerous. The second is the method of maintenance control by using functional foods of herbal origin to control diabetes, but only in short bursts. This method is safer and more benign than using Western medicine. However, this is not a method that can be used in the long term because it does not meet the nutritional problems of patient or does not help to solve the main problem, getting the root of the disease. For diabetics who only use these methods of maintenance supplements without focusing on comprehensive nutrition, the body will gradually become deficient and unable to recover. For there, it is easy to develop other underlying disease that can cause dangerous complications. And the last method, which is also the most appreciated method today, is the intensive control method with comprehensive combined nutrition therapy. That is combining conventional diabetes control measures with high-tech dairy-intensive nutrition therapy for patients. This method will have a comprehensive effect, both helping to supplement the intensive nutrients that people with diabetes lack, restore and regenerate damaged organs, especially the pancreas, and have some controlling effects. Control blood sugar, therefore, preventing dangerous complications of the disease. This currently is the most optimal method to address the root cause of diabetes and is also being recommended to be applied to many large hospitals around the world. The United States is one of the countries with the highest prevalence of diabetes in the world, accounting for 50% of the population. Therefore, the leading medical experts in my country always focus on research to come up with the best technologies in treatment of this disease. After many years of research of testing, we have successfully researched cellular energy sensing technology. This combined with America's leading technology Phytosome to produce high-tech diabetic dairy product Glufarelin. Capable of control diabetes from the cellular level, address the root causes of diabetes. Thanks to successful application of cellular energy sensing technology to the amino acid complex, Glufarelin has the ability to control diabetes from the cellular level. This helps increase the sensitivity of cells to insulin and to help cells to tolerate insulin again. In turn, solving the root problem of cells' resistance to insulin, the main factor that accounts for 95% of causes of diabetes. Meanwhile, America's leading Phytosome technology helps to increase the effective bioavailability of micronutrients in milk, thus targeting the pancreas to restore pancreatic function to strongly stimulate insulin production. These are the two leading technologies in the world capable of comprehensively inhibiting the causes of diabetes, and Glufarelin is also the first and only product in the world that successfully applies cellular energy sensing technology combined with Phytosome technology to support diabetes control from the root cause. In addition, Glufarelin is high diabetic milk with perfect milk formula. Contains 100% whey rich protein along with amino acids, multivitamins to help provide a complete and balanced nutrition for patients, thereby aid in preventing dangerous complications caused by diabetes such as kidney failure, stroke caused by diabetes. Currently, Glufarelin high-tech diabetic milk is also an intensive nutritional product that is being trusted by our doctors at major hospitals around the world to apply in combination of diabetics. This is the product that is highly appreciated by many leading experts in nutrition and diabetes for its quality and effectiveness in diabetes control and has been trusted by many patients. Glufarelin high-tech diabetes milk is a great step forward in supporting the treatment of diabetes in the world and is the pride of American medical technology. This product has opened a new door for diabetics to live a healthy life without worrying about dangerous complications later on. This is the #1 specialized product for people with diabetes, trusted by millions of patients around the world because of its effectiveness, absolute safety, and health benefits for users. High-tech diabetic milk Glufarelin is currently the world's best diabetic milk nutrition therapy suitable for all conditions of diabetics. Anyone can use. People with type 1 diabetes, type 2 diabetes, and gestational diabetes with symptoms such as frequent urination at night, high blood sugar, thirst, weak eyesight, numbness in hands and feet. Using Glufarelin high-tech diabetic dairy product will feel first that the blood sugar and blood pressure indicators are stable day by day, followed by a healthy body. Refreshing due to being supplemented with intensive nutrition, the disease symptoms are also decreased quickly. From there, the body is completely healed and repels the dangerous complications of the disease. And finally, I also recommend that people with diabetes need to understand the root cause of the disease, avoid cases of transient treatment. Understand that your illness needs and lacks. And when using Glufarelin high-tech diabetic dairy products, you need to be patient. Use it correctly, and most importantly, you must also follow a healthy lifestyle for long-term health because Glufarelin is an effective treatment. The most effective and best are being trusted by many users around the world to choose to use.